Behind every addiction, there's pain. That statement became real when we were at a clinic in Everett, Washington that treats addiction. And it became real when we met one patient named Amy. She had relapsed on heroin, and on this day, she's thinking of quitting again.
Which is scary. It's a scary thought to think about, quitting.
But Amy says she's scared.
What are you scared about?
Amy speaks in a low voice. And even though we're all crammed into a tiny exam room, craning forward to hear her, sometimes she's a little hard to understand.
I don't know. I used to not feel,
You used to
I used to not feel.
not feel.
Mm-hmm.
She used to not feel.
A lot of wreckage in my past to have to deal with.
A lot of wreckage in her past to have to deal with.
I've been using drugs since I was 12.
Oh. And how old are you now?
32. Mostly meth, until I was like 28, then heroin. So, yeah.
Yeah. That's a long time.
Yeah, off and on. It is a long time, And like I said, my teeth are horrible. Like, thank God they've been falling out from the back forward, so the front's still look okay, but the side's getting pretty close. So, yeah.
Meth is making her teeth fall out. That's a common side effect. But she laughs because at least the ones in the back are going first. That's some dark humor. Amy really taught me something that day. People who aren't addicted to drugs, like myself, don't usually understand something very key to addiction. Amy is saying once she stops using drugs, that's when life is going to get hard. She's going to have to feel. The drugs are not the problem. It's the pain of living that's the problem. And pain is driving this opioid epidemic. I'm Anna Boyko-Wyrock.
And I'm Kyle Norris. We're radio journalists in Seattle. This podcast is called Finding Fixes. It's about solutions to the opioid epidemic.
People ask, what's the solution to the opioid epidemic? But it's not just one solution.
We're going to look at how we can stop people from getting addicted in the first place, from hurting themselves and their family and friends and communities, and how we can stop people from dying. Each episode, we're going to dive into one solution and the people behind it. Those solutions include medical help and counseling. We'll check out a nose spray that brings people back from overdoses, and take a good, honest look at all the pain pills that are out there. Anna and I have spent months getting to know the folks in the Puget Sound region connected to this issue. They've let us spend a lot of time picking their brains and following them around. And we'll both take turns hosting this podcast and telling you about the people we've met and what they're doing. Today, Anna takes you there.
This episode, we're in Everett, Washington. It's just north of Seattle, less than an hour away, if there's no traffic. Just to give you a visual, there are great views of Puget Sound and snow-capped mountains. Seagulls are a constant companion, and Boeing builds a lot of planes here. 2 years ago, the Los Angeles Times chronicled how black market OxyContin from LA plunged the city into addiction and heartbreak. The city is also suing Purdue Pharma, which makes OxyContin. But in this podcast, we're not looking at how the opioid crisis happened, but instead, how to fix it. And one place that's trying hard is Ideal Option. It's a private clinic close to downtown Everett in a tan building. The front door never quite stays closed. The hinge is a little wonky, but also because people are constantly coming in and out. Patients are coming here to get help treating their addiction to alcohol or opioids. When they come in for an appointment, they give urine samples to a lab tech who tests it in this machine. They named the machine Vivian, by the way. Her job is to find traces of drugs. And patients spend some time with this guy.
Who are you?
Jeff Godfrey, nurse practitioner. But wait, there's more.
Oh yes, there's more. He does a Brooklyn accent.
What are we talking? Forget about it. We're not. Don't go there.
An imitation of a drug craving.
I want my drugs. I want to make you happy.
And an opera aficionado.
Yes, beautiful.
Jeff is so pumped up by his work, the exuberance comes naturally.
I'm really excited about doing this. I was an old ER nurse practitioner, and this has been the best thing I've ever done in my life.
Why?
Why? it's healing, you know. So many times we look for a cure, but it's the active art of healing. And by engaging these people, you really feel like you are part of the therapeutic community. These patients need the help, and then to watch them just get themselves healed, and they do it themselves, they get control back, and it's just the most amazing thing.
It's actually incredible how pumped up he is by this work, because it shows that he's seen a lot of powerful, positive change in people with addiction. This transformation comes in part from what's considered the gold standard in addiction treatment, treating people addicted to opioids by using medicine. You might have heard of methadone. That's one kind of medicine for opioid addiction, and it's been used for decades. And maybe you've heard of another drug, naloxone or Narcan. That's the overdose reversal drug. That's given to someone who has just overdosed to save their life. Lots of paramedics and police officers give it to people. We're going to talk about Narcan on a different episode. The medicine at this clinic is buprenorphine. It also goes by the brand name Suboxone. Remember these two words because people use them interchangeably. It's sort of like the words Kleenex and tissues. Suboxone is the brand name, buprenorphine is the main ingredient. Anyway, buprenorphine, or Suboxone, comes as a tablet or a strip, kind of like a Listerine breath strip that dissolves under your tongue.
When I take the medication, I just put it underneath my tongue and I go about my day.
And such a small thing can be a big boost. Megan Midkiff lives just south of Everett. She's been on Suboxone for 2 years. Today, she thinks about her children, her schoolwork, and her friends and church. When she was on heroin, it hijacked her brain.
It's all consuming. It's all consuming, and that's all you want, all you need, and all you're going to do is to get that, because you're at that point, you're just trying to get well. You're not even trying to get high. You're just trying to not be sick.
If someone with an opioid addiction, like Megan, doesn't have a steady stream of the drug into their system, they go into withdrawal, which many people describe as the worst flu you've ever had.
I couldn't take care of my son. I couldn't talk to any of my friends. I couldn't work. I couldn't do anything. It ruined my life. It took everything from me, whereas Suboxone gives me my life.
Now, Megan doesn't have to worry about withdrawals because the medication stops those flu-like symptoms and stops cravings. There's a lot of evidence to back up the effectiveness of this medication, and methadone too, by the way. For example, one study in Massachusetts found people taking the medication were more likely to stay alive and stay off drugs than people in treatment who didn't use medication. Patients on buprenorphine were 30% more likely to avoid a relapse. And, this is pretty remarkable, patients on medication were 50% more likely to stay alive than patients in drug treatment without medication. 50%. The problem, though, is how to get the medication to everyone that needs it. That's where clinics like the one in Everett come in.
I normally have really low blood pressure, but...
Today, Hallie Martin is coming in for the first time to start treatment using medication. First, a medical assistant takes her blood pressure. Then she leads her to an exam room. Hallie is 22. She texts constantly with her boyfriend and sips a Red Bull Italian soda. It's bright turquoise.
Is that your boyfriend?
Mm-hmm. It's been blowing my phone up since I got here. I don't know why.
Later, I find out that she and I were born in the same hospital in Eastern Washington, Sacred Heart.
Hello.
Hi.
How are you?
Good, how are you?
Ideal Option is not like any clinic I've ever been in. Hallie is going to do an intake interview with a medical assistant on video chat, kind of like Skype. The medical assistant is hundreds of miles away on the other side of Washington state.
Name Hallie?
Yep.
Hallie sits in the exam room in a chair facing a large screen with the medical assistant's face on it. There's a camera to capture Hallie's face. The word in the medical field for this kind of setup is telemedicine. It's a way to stretch resources and serve as many patients as possible.
So this is your first ever visit with us, right?
Yep.
What are we seeing you for? Alcohol addiction or?
Opiate addiction.
Peyton Drury, the medical assistant, asks Hallie a bunch of questions about her addiction, just like she would if they were sitting in the same room.
Okay, what would you say is your primary substance problem?
Heroin.
And if you could rate the severity of your addiction on a scale from 1 to 10, 1 being mild, 10 being severe, what would you rate it today?
An 11. So a 10.
Hallie has been on opioids since she was 12 years old. That's when she started on pills. She was smoking heroin at 18 and shooting up at 20. Hallie and the medical assistant cover a lot of ground.
I suffer from severe depression and anxiety and a lot of shame and guilt. I have really bad pain in my back though and my hips because I used to be a gymnast and I got hurt.
And started drinking a lot in high school.
I did not keep track. I drank until I was drunk. So however much that took, that's what I drank.
Hallie says she has a family history of addiction.
Oh, I have severe PTSD. Duh, forgot about that.
All of this history is important. All of these things contribute to addiction. Let's just get it out there and say addiction is not a choice. It's a really complicated disease, and family history, injury, early exposure to drugs and alcohol, mental illness, and trauma play a big, big role. Sometimes it seems so random that some people get really lucky with the hand they're dealt and never develop an addiction, and some people get really unlucky and face a big struggle. Peyton and Hallie have a lot more questions to get through. On the screen, you can see Peyton, the medical assistant, all the way on the other side of the state, plow ahead. She removes her cardigan, revealing a sleeve of tattoos.
Okay, I like your tattoos.
Thank you. So
Hallie also has tattoos on her fingers and hands. You can see a big one on her neck with flowers when she pulls back her hair. It reads, "Fate fell short." After the questions, the funny nurse practitioner Jeff comes in.
So, we're going to get started. So, what do I do with my pen? I just left it. I'll be right back. Yeah, look at me. Yeah, I'm an old guy.
Jeff's about to work his magic with Hallie.
He's the funniest doctor I think I've ever had.
Where's that?
All right, got it.
All my other Suboxone doctors and just my psychiatrists are really straight-faced and just boring. I'm like, but you're not.
But I've got a lousy bedside manner. I warned you, right? And because I'm going to hold your feet to the fire. I expect all my patients to engage and love themselves enough to work freaking hard. And you know what? I think you're ready for this.
Jeff and Hallie have met before. Her boyfriend is also a patient here. The couple decided to stop using drugs on Valentine's Day this year. It's March 9th, the day we meet her. Jeff asks her his usual questions.
And are you a shooter or a smoker?
Maybe.
Can I see your arms?
I don't have any veins. They couldn't even draw blood in detox.
Strong work.
The only vein I have left is my neck.
And when's the last time you shot in your neck?
February 14th.
Fantastic. And you've been clean since?
February 14th.
Right. So
well, since that day.
Just since that day, right. So what that was your last hurrah, wasn't it?
Yeah.
Yeah. All right. You know what?
But Jeff is hopeful. Recovering from heroin means her body will have a chance to heal. There's a good chance the medication will help Hallie. Another study looked at Suboxone patients over 4 years. It found over 60% were not using illegal drugs that long after starting the medication. 60%. So this medication doesn't work for everyone all the time, but it works for a lot of people.
All right. So you're going to drink 16 to 32 ounces of warm water.
Jeff walks Hallie through how to take it. He writes down notes for her as he talks. She's supposed to keep the tablets under her tongue for a little while.
You're going to set your timer for 40 minutes. And then you're going to start writing out your daily list. Because you got 40 minutes with spit in your mouth. What the heck else are you going to do? You're going to live your life, right?
Jeff wants patients to start rebuilding their brains, too.
Make each thing that you're going to do in your life, something that's going to really help you drive you forward, okay?
For Hallie and for many other patients, living without drugs means she will need a whole set of different tools to help her get through the day.
So, and counseling, are you already scheduled?
Help her cope with
All right,
challenges
Melanie,
and
great.
pain.
Intake. When you get in
Drugs
here,
used to be the solution. Now she has to rely on other things for support.
Ding, the timer goes off. Spit that crap out, and then no smoking an hour afterwards.
One more way this
So we're
clinic
doing
is
the
different
5,
from other places.
Siri, please call IO Dr. Martin Dubeck.
Calling IODR Martin Dubeck.
The actual doctor prescribing the medication isn't in the office either.
All right.
Dr. Dubeck is about 30 miles north of here in another town.
So I'm Dr. Dubeck. My name's going to be on your prescription.
There's a reason for this.
The demand is incredible.
We called up the head of the Ideal Option Clinic to explain to us how it works. This clinic in Everett is actually part of a network of 36 clinics across 8 states. Dr. Jeff Allgaier is the CEO of Ideal Option. He says there are just not enough doctors to treat everyone who needs it.
Addiction medicine is not something that people go to medical school and say, I want to practice addiction medicine.
You can also prescribe buprenorphine if you're a nurse practitioner or physician's assistant. But everyone has to take an 8-hour course and get a special license. Allgaier says, on top of that, there are federal regulations that limit how many patients providers can prescribe buprenorphine to. These regulations are trying to prevent pill mills.
And pill mills are basically where practitioners will go in and hand out prescriptions, and that's about all they do, hand out prescriptions in exchange for money.
Too many drugs handed out without oversight.
Which is one of the issues, the things that got us into this problem in the first place.
So now, say you're a doctor or a nurse practitioner or a physician assistant. You want to help people get off heroin or pain pills, and you want to prescribe buprenorphine to help them. You take an 8-hour class, get a federal license. Then, for the first year after that, you can only treat 30 patients. That's by law. Over time, you can go back to the federal government and get permission to treat up to 275 people a year. The clinic in Everett, though, sees more patients than that in a week.
There is so much more demand for our services than there is a supply of folks being able to provide those services.
So that's why they use telemedicine. It helps meet that demand.
All right. So let me ask you this real quick.
Dr. Dubeck peers out from the iPhone screen and talks to Hallie. The nurse practitioner, Jeff Godfrey, holds the phone and Dr. Dubeck's face in his hand.
More happy to have you, and I wish you the best of luck.
Thank you.
Thanks,
Means a
Hallie.
lot.
Thanks, Dr. Dubeck.
You're welcome, sir.
Aye, Captain. Oh, you got the beard going, man. Hi there.
No, I just didn't shave. I shaved yesterday.
Okay, I'll talk to you. I'll talk to you soon.
Thanks, sir.
Thanks, sir.
Hallie is following a path that others have been down before. Remember Megan Midkiff from earlier in the episode? She's been on buprenorphine medication for 2 years. And we should mention one more thing about buprenorphine. It is itself an opioid. For some people, that means as a treatment for addiction, it's a non-starter. It's pretty polarizing.
If you're on medication assistance, you're not clean in their eyes.
That's Megan. That stigma comes from a surprising place, from within the drug treatment community. Narcotics Anonymous, for example, defines being clean as being totally abstinent from everything, including addiction treatment medication. NA asks people on medication like buprenorphine or methadone to listen at NA meetings instead of sharing their experiences in front of the group. Megan says that rule isn't exactly enforced.
I have shared at quite a few meetings where I say it's hard to not feel less than, or, that I'm not clean, or, I don't know what freedom tastes like yet.
Megan's body is dependent on buprenorphine medication. If she doesn't take it, she will experience withdrawal symptoms.
The sniffles or body aches, dry mouth, headache, sweaty, cold chills, and it'll progressively get worse unless I take my medication.
So you're still physically dependent on
Yes,
an
I'm
opiate.
physically dependent.
But do you feel addicted?
No, not at all.
There's a big difference if you follow the clinical definition of addiction. You can find that definition in the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders. People in the field call it the DSM-5. Technically, in the book, they don't call it addiction. They call it substance use disorder. And according to that definition, you have a substance use disorder when you compulsively seek out and use drugs despite harmful consequences. It interferes with normal life. It causes problems in your life. That's not what's going on with Megan.
I'm in the car by 9:10 every morning.
She drives in traffic, takes her daughter to school, goes to college classes where she's studying early childhood education.
And when I get out of school, I have about 4 hours before I have to pick my daughter up. And I usually spend it on campus in the library or the computer lab.
Compare that to what daily life was like when she and her boyfriend at the time were deep in their addiction.
We spent hours, days in a car. When you're trying to get your drugs, first you're running around to try and, either pawn or hustle something. And then you're spending time waiting.
Waiting for the drug dealer.
Yes.
But the opposite of addiction isn't medication. Not according to Megan.
You said something that just blew me away. It was so well said the other day on the phone, that the opposite of addiction is connection.
Yes, the opposite of addiction is connection. If you have a support system, a well-established foundation, you can do anything, That's what you need.
For Megan, that's her family and friends, a community through church, her allies at different social services programs. Medication is important, but so is learning to share her feelings.
If you're frustrated, you can confide in somebody, I've had to learn how to not shut out my friends. Whenever I was having a hard time, I didn't want to bother anybody. And I have had to learn to just go ahead and, say it, because they're not going to think I'm stupid. They're not going to laugh or be annoyed.
Everyone's path is different. No one treatment works for everyone. Remember Amy from the beginning of the episode?
I've been using drugs since I was 12.
And how old are you now?
32.
We caught up with her months later over Facebook. Amy didn't last long in the Suboxone program. She says she's still in the same place she was before, afraid to stop using drugs. But soon, she's going to have to detox. The wreckage of her past is catching up with her in the form of a felony burglary case. Amy is facing prison time. By contrast, Hallie is starting a new chapter. She's done treatment before. She's relapsed before. This time, she wants it to stick.
I was alive, but I wasn't living. I was just surviving. And it's not fun. It's like a terrible, vicious cycle you get in, because then you start to feel all this shame and guilt about doing it, but then you use to cover that shame and guilt up. So you just keep going and going and going until you're just completely dead inside.
Hallie wants to get back to living. And we have reached the end of this episode. We focused on medication and telemedicine to expand treatment for opioid addiction. Join us next time on Finding Fixes for this story.
So I did it, and he didn't really wake up, so I went and got the other one. He woke up, jumped up instantly, and he was like, "What happened?" And I was like, "I had to Narcan you," and he was like, "Narcan?"
We'll talk about how to stop death in its tracks.
This episode was produced by Anna Boyko-Wyrock and me, Kyle Norris. Finding Fixes is a project of Investigate West, a journalism nonprofit, reporting on public health, the environment, and government accountability. Julia Drockman is our producer. Elisa Barba is our editor. Joan Kane is our fairy godmother. We've got music by Jake Weholt and help from Jarrett Jackson. Photos by Leah Nash.
And help from Paul Kiefer.
Find us on social media and online at findingfixes.com. You can leave us a review on iTunes or send us a message at fixes@findingfixes.com.